delighted to introduce Claire Taylor. And is June with you? June's there as well. Amazing. June and Claire both work with Macmillan and are here to talk us through the ACCEND programme. Thank you.
Hello everybody, it's a real pleasure to be here this afternoon, and I'm just looking at June. We haven't had much conversation today, but I've noticed that we've both come in our most flowery shirts going, so to make sure it's feeling like a really nice spring day, feeling very cheerful, and it's lovely to be presenting this session with June. So my name's Claire Taylor, I'm Chief Nursing Officer at Macmillan, and I'm also a Senior Oncology Nurse at London North West, and I can see some of my colleagues in the back row who promised not to heckle. But no, this is a double act, so June, do you want to just wave? And I'm going to start off with a little introduction about the ACCEND programme, and then I'm going to hand over to June, who lives and breathes ACCEND, I can tell you, and give you much more insight into actually what the programme's all about. Then I'll pick up at the role profiles. But what we want to do is have about half our session talking around your tables about some questions that we've got. Elaine very kindly shared with us some headlines from the survey, which many of you have completed. Super helpful, thank you. That indicated about half of the people replying to the survey didn't know what the ACCEND programme was. So that's actually, it's been very helpful for us to understand that actually, why we need the session today is hopefully to improve your understanding of the programme. So I think the discussion section will be really helpful to share your understandings and actually start to think. We're at the point now with this where, what does this mean for me? How are we going to implement it? How can it help me in my career? And it fits quite nicely with the last session, actually, because this is all about an aspirant cancer career and an education development programme. That's what it stands for. It's a fantastic acronym, isn't it? The work has been going on for some time. In fact, I first got involved with it nearly 2.5 years ago, and June much longer when she was kind of conceiving the idea with others. And what's wonderful about it actually is there's many partners involved in it, as many stakeholders you can see involved in the delivery of it from that strapline at the back. We've got UConn's Macmillan guys, Greater Manchester, Chester and Merseyside and NHS England have, which was Health Education England have provided the money for this, and WDE in Bristol. So lots of people involved, and this is about providing you with guidance, direction. And what hopefully is going to inform you is the knowledge, skills and capabilities you need for your career, for the roles that you have. And it's really embracing it's from end to end of the pathway. It's from the supportive assistant right through to consultant leaders. So every level, multi-level pathway. And we didn't have anything like that before, did we? So it was very much needed to think about not just the specialist workforce, but the generalist workforce. And what I particularly like about it is encompassing of nurses and allied healthcare professionals. So it's really nice that I'm here for nursing and June's an allied healthcare professional. We're thinking about, our career frameworks together and what the synergies might be and how we can learn from each other is a good part of that. So it's we work increasingly in multi-professional teams, so it makes sense for us to be thinking in that way. And that was very much echoed in the long-term plan. So it's been a huge amount of engagements to get to the point where we published the framework and the development programme. You can see lots and lots of people have been involved, and it's been tremendously collaborative. Macmillan's role in it, besides hosting project and programme managers, has been quite considerable, along with many of those other stakeholders. So we're really right behind it, and it's always a pleasure to talk about it. Even more important is that it's embedded now within the long-term workforce plan. So you'll be aware that that was published in the summer, updated in January, and this is seen as a key way in which we can modernise our workforce, in particular in cancer. So it's referenced in the plan for saying that NHS organisations have a role in ensuring available career pathways, frameworks, training opportunities are offered, such as through the ACCEND programme. So we're seen to be an exemplar of how we may be able to do this. So giving you that framework for your career, providing training opportunities is what ACCEND is all about. And that's then been put into a Cancer Alliance planning packs to help the delivery of that. And if you've read the long-term workforce plan, you'll know that the three kind of key ambitions of that are to train, to retain, and also to reform. And so the thinking about the recruitment, is thinking, how do we get people into cancer care? It wasn't easy before we had ACCEND to know what qualifications did you need, what capabilities might I need to sort of take on those specialist roles. So it's giving you that sense of where you might want to be. But I think it's also helping people to stay in their jobs, to get more job satisfaction and see more opportunities for development. And finally, I think because it's offering different ways of training, that it's transforming our opportunities for career development. So it's very much aligned with the NHS workforce plan. It's not going away. This is the way forward for us in cancer care for nursing and allied healthcare professionals. I'm going to hand over to June to give you more on the detail.
Brilliant, thank you so much, Claire, and we coordinated brilliantly. So really great to be here, and thank you, Nate, for enabling us to come and talk to you all. I feel slightly, we've got such experts in the room, so I'll do my best. But I guess this is quite interesting because we've been on a real journey here. And I know anybody that knows me, I talk about a number of things. This is absolutely one of them. And I think we haven't got great signature tune. We've got great colleagues in NHS England, and the team are changing. But we've heard several times their commitment in terms of the priority within the cancer and diagnostics team within NHS England. And I just wanted to say that it may be that some of their other things come under this umbrella, which is kind of really good as an overarching thing. So I think that's quite important. We are in a state of planning for 24-25, and the planning, it's like planning on planning, and it really is, and prioritisation and reprioritisation. So I think I will come to some of the things we are thinking about, but don't take it in tablets of stone, because we've got another prioritisation meeting on Monday. It's one of those. I'm just sharing how it really is, because it's changeable, but the opportunities are great, and that's why it's so important, this work. So anybody read the framework, accessed the framework? Elaine's nodding. Lovely. Right, good. Nate's read it. Brilliant. No, it doesn't matter. But you know about it's a good thing. Great. So, okay. So that was published, and Claire rightly said, so January last year, and Professor Vanessa Taylor was the lead author for that work, bringing in about 30 different frameworks. So we've got allied health professional ones, we've got nursing ones across Macmillan, ACCEND, all the different bodies, and it's trying to bring those together. And we deliberately have called them core capabilities in practice, and they come under different domains, and you will see that. It isn't a small document. We are aware of that. It's about 190 pages. But that shows the complexity of something like this, and not underselling the importance of what we need as professionals collectively to do our jobs, and for you all to do your jobs. And so that's quite important. So when we get to the questions, there's a thing about, well, how is this important to me? How is this going to get used? And it's got to be in usable formats. So anyway, I'll come back to that, because clearly this is significant bedtime reading for several nights, I think. I'm not underselling it. It's just, it takes time to get it socialised. And then we've got implementation guides. So we've got implementation guides for employers, for professionals, and for the education sector. So again, they are quite helpful in terms of just helping understand how to use this framework. And of course, it depends what lens you're looking at it from, I guess. And the framework itself, which is the foundation of anything else that we do in ACCEND, to be fair, we always refer back to the framework, and it really had to be done first. 3 components: career pathways, which include the levels of practice, and we don't go anywhere near agenda for change. You've seen that, and there's deliberate Yes, so I'll leave it there, but we know that across the country, if you're an enhanced level practitioner in A, you might not get paid the same as in B, but that is not what this framework is about. It's about the levels of practice, supportive, assistive, registered, enhanced, advanced, consultant practice. And then the second bit is the core capabilities, the cancer capabilities in practice. They are hopefully colour-coded for each level of practice. And then the education framework, setting standards. So this, again, a bit like sort of patient care, really. This is about trying to get an equitable standard UK-wide, because at the moment, we have different levels of equity in terms of what people can access, what they can do to increase their skills, knowledge and capabilities. So there are some standards around what those education offers are at the different levels of practice and should really be. And then those three come together to comprise the framework in its entirety. I just popped this in just because we keep getting this question. And I'm sure everybody knows this, but just for clarity, you know, we did debate this, capability and competence, and they are both about what people can do. They describe knowledge, skills and behaviours. They can be about the outcome of the education, training or the experience, but the capabilities here describe the ability to be competent and to work effectively in those situations. And I guess when we did this, and Claire alluded to it earlier, we weren't just thinking about, and I'm standing in a room with people who work in oncology predominantly, perhaps, but actually we know that many people in the workforce will see people with cancer in their lifetime, so we have to have some level of competence and capability for those people in generalist roles. I don't know particularly like the term, but you know what I mean, in community, primary care and acute settings. So really, really important. So the levels of practice are there. I think although ACCEND's called ACCEND, and we've just had a great presentation around leadership, actually people will move in a matrix perhaps in their careers, so that's okay too. It doesn't have to necessarily be just constantly up, because you might have to go around to get up, and if up isn't the only way, if that makes sense, we know that, but that matters, I think. We've described the levels of practice and given examples there, so people are clear. Certainly my experience has been, and I don't know if it's yours, the understanding of what, for example, an enhanced practitioner is, an enhanced nurse, an enhanced AHP, I'm not sure is entirely clear. If I were to ask, you may all know, but for me, I'm not sure it's clear to people who may or may not be working at that level of practice, because it's new terminology, relatively, even advanced, to be fair. So we've got the NHSE or previously HE definitions, etc., but that's important for us to be clear what we're talking about here. Just while I remember, we have talked to the regulators about this. Obviously, the regulators have a certain job to do. It was more to raise awareness around to certainly the Health and Care Professions Council and to the Nursing and Midwifery Council about ACCEND and what it is, and to share that with their stakeholders, particularly when they're having conversations with the education providers. So, and to share that with their registrants, if you like. Clearly, there are different ways that this framework can be used, and we will talk about this, or you will shortly. There is, within the framework, this is just a screenshot, but a self-assessment. So we're trying to link this back to revalidation and CPD audits, depending on which professional groups you're in, for re-registration, and where you sit versus where the gaps might be versus where that might inform your continuing professional development around your knowledge, skills and capabilities. And great if it's integrated in some shape or form into appraisals, performance development reviews, whatever they're called in different organisations. So you will have seen, perhaps, if you've looked at the framework, or you will see this. So this is just an example of what the self-assessment tool looks like and where you might see yourself. And it's to try and help you understand, as I say, where you're at and where you need to be. On that note, I know one of our project managers, James, would say to me, June, I can hear him in my ear, Not quite, right, because we talk to each other every day. He's done a fantastic, and I'll send it to Nate. It's really simple, this, but it's so useful. Excel spreadsheet, that is really simple. And he's locked the core capabilities, I think that's the term. But you can then fill the thing in, because at the moment you can't. We are looking at digitalising the thing, but before that happens, let's just get something that's sort of usable. Some of you may have done it already, because some people will do that sort of thing, but if it's helpful, so I'll send it to you. So the other thing about the framework is it can be used for role redesign and thinking about a team, service, and can be used to standardise job descriptions. I mean, that's another industry, I'm sure, the job description piece, but it matters, particularly in a team and for equity, and also inform education and training. Definitely, whether that's within a trust, the university sector, etc., doesn't matter. I'm really, this is a whistle stop of the whole thing, really, but I don't know if colleagues have accessed the Learning Hub. Well, you will have accessed the NHS Learning Hub, I'm sure, but I don't know if colleagues access the ACCEND bit on there. Know it exists. A few nods. Marvellous. Right, so on there, and you can have any email address now. They call it green access. That's not Macmillan green, that's green as in you can have a Hotmail, a Google account, whatever, which that matters too. Supportive and assistive toolkit is on there, so that's for support workers and of any description, really. So there's a whole raft of really great stuff on there for that, those levels of practice. There is also the 9 modules Foundations of Cancer Care. So that was initially written for pre-registration students. However, across professions, you don't have to do all 9. My personal view is that could be used for newly qualified colleagues. It could be used for people at a senior level in another specialty who've never worked in oncology. I had a conversation yesterday with somebody about that. There's no reason, if they want to know more about chemotherapy, radiotherapy, or new treatments, or whatever it might be, to go into that is quite useful. So just please do access. We are working at the moment, definitely the Royal We, on the Registration Enhanced Advanced, which is a big group, clearly, and the majority of the workforce, and that's work in progress at this time. And then we will move to leadership and consultant practice. Again, this is just give you a flavour of the things we're considering. So this is prioritisation, but don't take it all to heart at the moment. We're just working out what the best thing to do is going forward in financial envelopes, as yet to be agreed. You can hear I'm being careful with language because it's work in progress and we have to wait for what the government says we're allowed to have, or NHSE, etc. So we've got the Principles in Cancer Care, which is currently running, led by Cheshire and Merseyside Cancer Alliance for the support workforce. Very successful programme. 250 people have been through that so far across England. Really important 4-day programme for people. There's quite a focus on the psychosocial support for people, which is really good because those people in those roles need it. And I have to say, we've had registered nurses and others say, oh, I really want to go on that too. This is a focus for supportive and assistive, but perhaps shows a need. I've talked about the hub. We will be, and I'm just very aware, we've got colleagues in the room who bid previously for the Innovation Training Funds. We are looking at that for 24-25. And we are also looking at, in order to understand the impact of a programme such as this, we have to consider what the workforce looks like at the moment. So baseline data and intelligence exercise sounds really exciting. It is, actually, because we really don't have anything that, well, we have data. Yes, we do have data, but it is not comprehensive, really. You've got data perhaps that Macmillan collected, or NHSE's got some data, some of the other Royal Colleges have got data, but we need to understand it as a totality. So we're pushing quite hard at the moment to get that done, because that will really help understand what the impact of a programme such as this is. We still have on our radar the multi-professional consultant pathway piece, We are working with the national team, NHSE national team on that, but that's another thing. 2 things came externally from the programme into the programme. Apparently this is how it works. So it was a thing, so well, it's more than a thing. NHS England had a level 2 psychological support task and finish group, which was set up to provide recommendations to this programme. Wonderful. So then we have to accept or not those recommendations. We've had conversations with them. Really good that's been raised because it's a big deal. We know that. So that's just going through at the moment, but is likely to be a priority for 24-25. The other piece, which has come from, and is not on this slide, from NHS England, is about the SACS workforce, and again that's come from the national group and recommendations, and some of those recommendations are around education and training around the SAC workforce specifically, so that's being considered as well at the moment. One of the other things that's happening, and colleagues will know perhaps, that in the pre-registration curricula for the different professional groups, depending on profession, depending on where you study, you will get none, some or a lot of oncology. And you can all reflect on what you had when you were training. And it's really mixed. So we've had conversations with the Council of Deans for Health, who oversee the and work with the universities across the United Kingdom, and the idea is to develop pre-registration curricular guidance, and we've just had a scoping report done by one of our colleagues, one of the fellows that's working with us to help move that along. That is a really important piece. We can't mandate, but we can certainly recommend that there are minimum standards here. That matters, I think, and it's also about student placements and all of that stuff. So, yeah, really interesting. I'll move on, I think. Claire, do you want to do role profiles?
Well, we haven't got that much time left, have we?
No. Shall we?
Just have a look at one, maybe.
Yeah, well, I mean, there's loads of words on here, really. It's just to give you... There are. I mean, there really are. I'm just saying, it's just... It will be... Within the ACCEND Learning Hub, we will have, as part of the Registered Enhanced Towards Advanced section, role profiles. The idea is that hub has got to speak to people like yourselves and anybody else who is interested in this space and developing themselves, etc. So we have to make them relevant and all the rest. So there will be a number on there across the disciplines at different levels of practice, and it will look a bit more exciting than I've just described there, but it just gives you a sense, and they will be at different levels of practice as well. I'll move on. So using the framework, we would like you, because I know it's sort of 5 to 3 or just before, on a Friday afternoon, and your energy levels will be low, and we probably need a physio up here doing, but, yeah, marvellous, but later, great. I guess... I don't know what you think, Claire. It would be helpful, perhaps, to have a conversation on your tables.
Yes.
About some of these questions.
Yes, I think we've still got maybe 15 minutes to do this, and then 5 minutes of feedback. Would that be all right? Okay. Yeah. So we came up with these 5 questions to get you thinking. So the first is, how would you implement this framework at team level? You will work in a number of teams, I'm sure, but maybe you could think with a person next to you, or if you want to do it as a table, depending on your configuration, some of the tables look a little bit separated out, but certainly to have conversations on your table. Second is, what steps and support would you need to implement this at organisational level? So lifting that up, who you might need to talk to, what resources you might need, what might be your next step from leaving today to think, okay, what do we need to do in our trust, in our unit, to implement ACCEND? How can it be used, this is more individual, to help you in your professional development? So the feedback from the survey was there's a lot of good conversations going on about your professional development, but perhaps not so much in terms of your cancer-specific developments. And this is what this is about. So be thinking, how can you be using this framework to help you in that respect? How can it support you in the development of capabilities in your current roles? bit more difficult if you don't know the framework, perhaps for us to do that one, but that's something perhaps to take away. And then how could it support induction content? Because I think it's great for new starters. If people coming in, you could really help them sort of plan out what capabilities, knowledge and skills they need to develop within the role to then achieve the competence for the role.